the skin is a window to the metabolic soul, where if there are two things you can observe just on your skin, and they're both generally going to be right around the neck.
Well, just sort of as a follow-up question, in this world we live in now where continuous glucose monitors are so becoming very popular, many people have them without a prescription, you can get them.
Yep.
Is there any signs or tests using those that people can do to kind of look for this potential problem with, having perhaps high insulin?
So to answer the question very directly, I'm an enormous advocate of CGM use. The more we democratize access to CGMs, I think the better we put individuals in a position to be their own coach. They don't need to have someone like me or you berating them and telling them to change their habits and eat a little better. When you see how your body's responding to what you're eating and the CGM enables that, you end up making your own lifestyle changes. But beyond the use of the CGM, if a person's curious about their insulin resistance, in many instances, you don't even need to get a blood test. The skin is a window to the metabolic soul, where if there are two things you can observe just on your skin, and they're both generally going to be right around the neck. One of them is a condition called acanthosis nigricans, which is when around the little skin fold that most people have around their neck, the skin will get darker pigmented, which can be harder to tell depending on the pigment of the person's skin. But what is obvious regardless of pigment is the kind of crinkled tissue paper texture of the skin. So the skin will be very sort of roughed, like crinkled tissue paper. So that's acanthosis nigricans around the neck. And then the other one people know is called skin tags. And that is those little, it's not like a rounded little mole, but rather a distinct little kind of mushroom stalk column of skin. People probably know what I'm talking about. You can see them around the neck. Sometimes you can see them around the armpits. But again, it's just a teeny little, like a little mushroom stalk almost of skin. Skin tags. Both of those are very, very strong evidence of insulin resistance. And the nice thing is, as the insulin sensitivity improves, those problems go away, just like everything else.